Oh, she didn't go live.
Yep, we're live.
Hello. Oh my gosh, I'm so excited. Dr. Devin Miles, you are here. I have been waiting. And yes, you are last, but we always save the best for last. So I'm so excited and grateful that you are here. Also, 1 week from today is the Women's Health Forum. So I am honored to have all my amazing panelists, and you are one of them, because we're going to answer some wonderful questions next week for all of the women, right, that need some questions answered by not just the regular medical practitioners, but also us that think outside the box, right? And that's why you're here today. So I'm going to just quickly introduce you. So welcome, Dr. Devin Miles. You are a wonderful naturopathic doctor and the owner of It's Time Natural Health. You conduct online consultations providing natural solutions for prevention, digestive health, and kidney function. You've helped clients improve their digestion, mood, energy, sleep, balance hormones, reduce blood sugar and reduce blood pressure, eliminate kidney stone formation, as well as stabilize and improve kidney function. And of course, my favorite, you reduce chronic pain. So welcome, Dr. Devin Miles. I am so honored. Do you want to say something to all of us before we go into the wonderful 3 questions?
No, I just thank you, and I'm very happy to be here, and glad to be on this platform with you today and next week. I think it's going to be great.
Yes, I am so excited. And you're in Texas, right?
I am, yes, but I see people all over the country and world, so I work through online consultations, so that makes it possible.
Yes, it's so exciting because now that there are different apps, right? One of them is Clubhouse, where you and I met.
Yep.
We're able to treat people from Australia, from England, from Canada. It's just really amazing. Hello, Catherine. Thank you for joining us. All right, so we're going to jump right into it. So, what is a naturopathic doctor? Can you tell us?
Yes, so the type of naturopathic doctor I am is technically a licensed naturopathic physician. So you have to be able to get that title, you go to one of 8 accredited schools in North America. It's a 4-year on-site curriculum. You take 2 board exams, you come out with a license to practice medicine. That license is recognized in 22 states, including DC, Puerto Rico, and the Virgin Islands. So what that encompasses, when you're a naturopathic physician, the titles could look like ND or NMD. So if you would only use the NMD title if you were in one of those licensed states. So what that fully looks like is a lot of different things. And so I'll start kind of with the I guess the more physician oriented thing. So we can prescribe medications, we can diagnose, order labs, do things like nutrient IVs, different spinal manipulations, like similar to what chiropractors do. Of course, they go to school just for that for 4 years, but we do enough to be effective. Also traditional Chinese medicine and acupuncture. Again, a little bit different from acupuncturists to go to school just for that for 4 years, but still quite enough to be effective. Mind body work, environmental medicine, and that can span from things that are very non-invasive to things that are invasive, such as IV chelation. Minor surgery, so removal of things like skin tags and warts. And then we also get into the foundations of naturopathic medicine, which is what I focus on. And you'll see a lot of naturopathic doctors who are in states that are yet to be licensed. These are the things that they focus on. So that would be herbs, high dose nutrients, lifestyle, diet changes, homeopathy, and a little bit of mind body work depending on what they do. I also use flower essences. So once you're a naturopathic doctor, you kind of decide out of everything I just mentioned what specific things you're going to focus on, as well as specific markets you're going to focus on, like depending on if it's a certain condition or a certain type of person, more female health versus men's health, children, adults, geriatrics. So yeah, that's it in a nutshell. So I provide those more of those foundations that for my clients, and those foundations by themselves are extremely powerful, and that's why naturopathic medicine is so effective even today.
Oh my gosh. And I'm so excited because that's why I wanted to bring you on today, because anyone that's watching can connect with you and have a consultation, right? So that's the beautiful thing of working online virtually with your clients, is because you can provide all this. Because here in the area where I live in the south of Mississippi, we don't have too many choices for naturopathic doctors as yourself. So I'm really grateful that you accepted our invitation. And I do want to put up the graphic though, so we can push the Women's Health Forum. So we're going to push put the graphic up right now for the Women's Health Forum. And you can see the 5 of us will be here next week to help you. This is the same time next week, April 21st at 6 p.m. Eastern, 5 o'clock Central. And we're going to be here, but we're not going to be publicly live. We're going to be privately live. So there's a way that we're going to do it where you can ask all your questions, but you're going to ask them privately in a small, well, not a small group, because we are going to be global, but you're just going to come in. We're going to ask you to ask the questions, and then we're going to be answering them for you. So thank you so much for joining us. I'm really excited. And so if anyone wants to also connect with me and ask me some questions about next Wednesday about our Women's Health Forum, please go ahead and email me at gulf.coast.myo, and it's over here on my website as well. All right, so we are going to move on to the first question, Dr. Miles. I'm sorry, second question, I should say. Why is it important to work on underlying chronic digestive issues? I absolutely love this question because I'm a big gut and brain person. So please tell us all why it's important.
Sure. So I get a lot of individuals coming to see me who have had digestive issues for a long time, and it just finally got to the point where they couldn't take it anymore. So when I talk about digestive issues, particularly I'm mentioning, and there can be a lot of different things, but particularly what I see people tend to ignore are things like bloating. That bloating is actually the number one reason why people finally come in to see me, because they're tired of it. It's happening all the time, and it just hits them that, this is probably not normal for me to be bloated all the time. So particularly with women, that's something that, it bothers them. So a lot of gas, a lot of belching, heartburn, constipation, diarrhea. Your stomach might feel tense. You may have some abdominal pain. That might be gas pains, right? You could also just notice that you have a nervous stomach, or you feel like anxiety is coming from your stomach instead of necessarily from emotions or your mind. And so there's people walking around doing these things, and they're just dealing with it because they don't see it as bad. It's not that bad. I can just move on with it, right? But those issues tend to get worse over time, and they tend to, digestive issues tend to permeate into other parts of your body. So I was diagnosed with irritable bowel syndrome at 22 years old. I started feeling it at 21. And it started looking like bloating and constipation. And then over time, the bloating got worse, the constipation got worse. What I had to do to try to ameliorate those things didn't work. I had to find new and more things to help myself. And then I started having an accumulation of food sensitivities that I didn't have before. Now, my experience as a child was that I had a few food allergies. So food sensitivities and allergies are two different things. And I had skin problems. Now, I, as a naturopath, know that those were probably connected, the digestive issues and the skin issues. And so that's another topic as to why people shouldn't ignore eczema or atopic dermatitis either. But yeah, so that started to be a real issue for me, all of these digestive issues. I had gone to two gastroenterologists. The second one is who diagnosed me with IBS. Nothing was wrong in the colonoscopy. Nothing was wrong in the endoscopy. Just a little bit of inflammation here, a little bit of congestion there, but that was it. And IBS explained what was going on with me, but there was no cure, and they didn't know where it came from. And I could appreciate that from the second gastroenterologist. I think by that point, we just wanted answers. We wanted honesty. So, but with that said, I had to go beyond that. So that's when I started delving into a natural approach and realized I liked what I was learning and decided to become a naturopathic doctor. So also what I have noticed is that with digestive issues, that tends to accompany a certain type of personality. And it could be somebody who's anxious, depressed. A lot of my clients with digestive issues, they tend to have a mild level of anxiety and depression. If it's something like major depression, I tend to refer to some of my other naturopathic colleagues who deal with major depression. But a lot of people with digestive issues tend to have anxiety or depression, at least mildly. They tend to be a worrier. They might have even been a worrier from childhood. So these are things that a parent might notice and might not think anything of it. They might be a perfectionist. They might be rigid. They might be hard on themselves, very critical of themselves and or others, always in their heads, overthinking, can't stop thinking, and just not overall relaxed. And they could also be very sensitive people. And that's something I've even talked with other naturopathic doctors about, is that people with digestive issues tend to be overall sensitive individuals, which is not a bad thing. But you have to know yourself and be able to navigate a little bit better than maybe you already are, because you think maybe sensitivity is a weakness, and it's not. You just got to know what to do about it, right? So, so all that to say, it can come to a place where you are anxious, depressed, not yourself anymore. You don't feel good about yourself. You don't have energy. You don't feel like getting out of bed in the morning. You don't feel motivated to go after the things that you want to do with your life. Your hormones can go out of whack. And so sometimes people come to me not for digestive issues, they come for hormonal issues. And I find out before the hormones went out of whack, the digestion was out of whack. And so these are other reasons as to why it's not in your best interest to ignore digestive issues, because they probably will get worse. They might go other places, including things like chronic headaches or being more prone to injury, or things don't heal as well as they did before. Mm-hmm. Your digestion manifests itself in so many other ways of your body. And so with the IBS, I had symptoms from head to toe almost. And, the thing that helped me was knowing, because I had a very fast response rate. So when I ate a food that my body didn't like, my symptom would come pretty soon after that. So that's how I was able to connect that my digestive system was affecting different things going on in my body. And like, for instance, also with dairy, I had nightmares. So I was like, okay, well, I'm not eating dairy anymore because it was a very bad nightmare, So it's just that if you go ahead.
Yeah. Can I interject right now, because you are one of the very few health practitioners that talk about that, because your gut will affect your brain, right? The gut and brain connection. But it's fascinating that you just said that dairy will even can cause nightmares. A lot of people don't know that. And I feel that it's the inflammation, right? Directly causing that. Because when my patients come in and they have this horrible back pain, neck pain, I have realized through the years, because my patients taught me that their gut, I could barely even touch their gut. And in physical therapy school, we're not really taught to manipulate the abdominal region. But once I started learning the John F. Barnes myofascial release method, and then some other types of treatments that I do, I realized that their bloating started to decrease. But guess what happened, Dr. Miles? Not only did their back pain start to get much, much better, but their sleep got better. And their anxiety and depression decreased, because, I deal with chronic physical pain, but that pain manifests emotionally and spiritually as well. And when I realized if we could get the gut to decrease in the inflammation and the pain and the bloating that directly decreased their pain. But one other thing that I learned was that they started to have bowel movements. So my patients, they joke with me, but they call me the poop queen. Every patient that comes in, we talk about having a bowel movement every single day the size of a banana. Why? Because if you're having those toxins in your intestinal system for days, you're literally destroying the lining of your gut. So I know that you know all of this, but I'm just trying to connect with the fact that their back pain, groin pain, hip pain, neck pain, everything started to decrease. And I was like, wow, this is fascinating. So I started to study something called PNI, psychoneuroimmunology. That brought me to the HPA axis, hypothalamus pituitary adrenal axis. Fascinating stuff, which we're not going to cover here, but I wanted just to thank you because this is a really a door that a lot of people have not opened. That's why we're doing the Women's Health Forum next week, because everyone wants to ask questions about so many things. And next week, there'll be 5 of us together that are going to be answering it. So I had to just jump in because I was so excited about what you're saying about, dairy alone can create like you said, the nightmare. So please go ahead and go on.
Yeah, and just because I know you deal with the physical pain, I grew up an athlete, and so in my 20s I rolled over my ankle, and so that it didn't heal as quickly as it should have, and I could tell that was because of the digestive issues I was having at the time, and I could tell that if I ate good, my ankle was better. If I didn't eat good, the ankle would either feel like it tightened up or it loosened. Either way, I'd have pain. So, and just I can feel sometimes, depending on what I eat, I might have tightness in different parts of my body, and I would just literally have to stay away from whatever that food was, and the tightness would loosen up. And it can go both ways, and that's the other thing that I think is unique about how I work, is that I'm trying to see where on the spectrum you are between digestive issues and mental health. So some people, they might be more of a mental health predominant picture, and then other people, they're more on digestive, or they may be somewhere in between. Either way, I usually work on both at the same time, and that seems to help with with accelerating the healing process and to helping my clients feel better just in general overall. It's not just the physical, but also they feel more clear, or they're not as irritated by different things going on in their life. And so that just makes the whole journey to health more smooth for them.
Yeah. Yeah. And I also add in the spiritual aspect as well. Meditation, yoga, just connecting with the divine, right? And knowing that we're not alone. So for me, it's God. For other people, it's inner light, inner wisdom, universe, divine loving light, all this beautiful thing, because I really feel that we can heal ourselves through the body, the mind, and the spirit. And so I always add that in a little bit. So thank you so much for answering that second question. So we're going to move on to the third question. So our third question is, why is keeping your blood pressure normal important for kidney function?
Yes. So sounds like a simple question, but it is a loaded question. So I'll start by saying that if you have high blood pressure, most people hear about, okay, well, keep your blood pressure down because you don't want to have something like a stroke, right? It's always like these cardiovascular consequences as to why someone would keep their blood pressure normalized. But the other issue that is not always talked about enough is the fact that if you have high blood pressure, that can damage your kidneys. And what I mean by that is if you start having kidney damage, you can start to have chronic kidney disease. Wow. So unfortunately, as somebody who focuses on kidney function, there are a lot of people, I would say at least 90% of the people who call me, they did not find out that they had kidney disease until stage 4, stage 5 kidney disease. Stage 5 is renal failure. So it's a major, major problem with the communication of doctors and their patients, because these are people who it's not like they're not going to the doctor for 4 years. They're regularly going to go get their blood pressure medication, and the communication is not there. And I think that has to do with the fact that dialysis is the only per se medical treatment. But there's a lot of things that I, as a naturopathic doctor, offer to help stabilize and improve kidney function. But with that said, because the communication is not always there from the doctors, down to the fact that they're not even educating the patients, you are at stage 1 kidney disease. This is what this means. This is what a GFR is. We stage the kidney disease by the GFR, knowing what creatinine is, knowing what BUN is. They're not talking about that. And so then the patient finds out, their patient finds out at stage 4, and then the doctor's saying, okay, we need to start talking about dialysis. We need to start maybe talking about transplant. And it's just their patients are like caught off guard and freaking out and everything. So all that to say, all of this happens because sometimes the blood pressure is high and uncontrolled. There's other reasons why kidney disease can happen as well, but blood pressure and diabetes are the top 2 reasons that people get kidney disease in the United States. So if your blood pressure is like 140/90 with medication, sometimes people I've noticed this also, is that sometimes they think that's okay. No, you're still around stage 2 hypertension. I'd rather we bring that down even further to get you in a more normal range of blood pressure. So the free ebook that I know we'll talk about a little bit later is.
Oh, no. I want to, you're talking about it now. So I'm going to ask, please bring up the graphic of your ebook. I'm going to try to bring it up right now. It's the green graphic, right? So we can find it. Okay. Well, there it is. Okay. Monitoring your own kidney function. And this is a gift for everybody who's watching right now, right? It's your free ebook. Right, Dr. Miles?
Yes.
Okay.
Yes. So this ebook is talking about how to monitor your own kidney function. There's just a few labs that I would love everyone to start monitoring for themselves and understanding what those numbers mean, and then bringing it back to your doctor and or some naturopathic doctor like myself, so that you can start to create, to find resolutions, to find help for your kidney function, as well as your blood pressure. So this is just a way to be more proactive about understanding what's going on with your kidney function and tracking it. There's also a tracker in there, so that you can start seeing over time what your kidney function is doing. But at a minimum, I would also say, if you have high blood pressure, to be measuring your blood pressure every day. Make sure you have a good blood pressure monitor, and just take it every day, write it down. That's, if you were to come to see me as a client, that's the information I'm going to want to see, is what your blood pressure has been doing every day. Because when I work with people with kidney function, I'm not just addressing the kidneys, I'm addressing whatever caused the kidneys to get damaged in the first place. So that includes things like the blood pressure.
Yeah. And so there's Stephanie who joined us. She's saying, up to 90% of serotonin is manufactured in the gut. That is fantastic, Stephanie, because a lot of people don't know that. So if you're eating too much sugar, you're eating too much dairy, you're interrupting the smooth process of digestion and making it harder for your gut to break things down, because you're interrupting it, because you're causing inflammation just by eating sugar and dairy. And Rita had mentioned that her blood pressure was really out of whack since last year. So these are things that we're going to also cover next week. But real quickly, what does one do that's something that's simple that you can decrease the blood pressure right away?
So a few things would be to reduce the salt in your diet, as well as exercise. So exercising at least 150 minutes per week. So that rounds out to about 30 minutes a day, at least 5 days a week. Sometimes if like your blood pressure was normal and then later on it's not normal, I encourage you to think about what's different now. Could it just be your age, or what else is different about your life? So also managing the stress is going to be very helpful. So there's people who are salt sensitive, you can also be stress sensitive, right? So exercise, keeping the salt down, and managing your stress. And those three are going to be pivotal to helping reduce blood pressure. And there's a lot more than that too.
I love it. Thank you so much. It's so, so simple. And so for me, I'm real big on exercise, meditation, and yoga to decrease the blood pressure. What the exercise does, when you're using your heart and lungs and you're moving, and you don't have to move fast. You know, if you don't want to run or walk fast, you don't have to, but just do something where you feel like you're really, really moving and using your heart. That when your blood pressure, when your blood starts to pump more blood through the entire circulatory system, you can actually wipe away some of the cholesterol that is clogging up the walls of your arteries. So that's what exercise does. It actually pushes through and cleanses. It's like a when you're wiping away snow, right? And so it's the same thing. So that's why exercise is good. Meditation is fantastic because it gets you out of that fight, flight, freeze response. So it decreases the stress hormones that are literally pooling into your gut. So your capillaries expand when you're in a stressful situation, and cortisol and adrenaline start pouring into the gut, right? Creating more of that inflammation in the gut. So meditation will decrease that. And then also deep breathing while you're meditating. And then of course, yoga. So those are the three things that I love to add to your infinite wisdom. So I am so grateful. We are almost at 30 minutes, and I just wanted to check on the comments and thank everyone so much for being here. So yeah, I don't think we see any more questions, but you know, that's why I'm doing the Women's Health Forum. I created it in 2017. We were speaking publicly in libraries and at the University of Southern Mississippi because I wanted to connect with the community so that everyone can have these simple ways of remaining healthy, especially us women, because we're in charge of our families. You know, we keep our husbands going, our children going. We're in charge of who or what medical or regular healthcare practitioners we see. So that's why I do this for free every year. And last year it broke my heart, but we couldn't do it. But this year, by pulling all of my beautiful, wisdom-filled, loving panelists together, and they agreeing with me to do this for free, we're offering to the entire public, right? Where a lot of other people from all over the world are going to be joining us, but you can't be a part of it if you don't register. So the link is right there. It's just, thank you, the Women's Health Forum.org. And just go in there, just put your name and email, and then we'll send you a link next week. Most likely the day before, you'll get an email just reminding you to join us next Wednesday at 5 p.m. Central, 6 o'clock Eastern, and bring your question. You know, just make it very brief, make it one sentence, and then we will have the panelists answer it as well. So that's why we're doing the Women's Health Forum, and that's why I brought wonderful Dr. Devin Miles, Betty Sue O'Brien, Dr. Liana Rodriguez, and executive health coach Tina Hong on board, because I wanted to get a more global aspect and a view of health. You know, what else is out there? You know, it's not just what one medical practitioner is telling us to do. It's what a flavor of things, right? There's a multitude of ways to heal ourselves, and we can't just stay in one box, right? We have to branch out outside of the box and see other things. So before we finish, would you like to say anything else, Dr. Devin Miles?
Yeah, I see a question from Ada. Well, what if my family has a history of heart disease? What can I do to reduce those chances of suffering from those same conditions? So, yes, so some of the same things that are important for helping to keep the blood pressure down if it's high, are some of those same things to be doing now to keep it from going high in the first place. So that is really important for anyone who's has anything running in their family, is to understand how those things happen. So, and the things that are necessary to keep them from happening. So things like the exercise, keeping the salt down, managing the stress, those are the foundations for beginning to prevent something, some other condition that's going on in your family. But if my focuses are, in addition to digestive health and kidney function, one of my focuses is prevention. So feel free to follow up with me and we can get you started on something that's going to be preventive in nature, that's sustainable for you.
Yes, prevention is key. That's what I focus on as well. I'm so grateful that you are here in the world, Dr. Miles. I'm honored and so grateful for you and your wisdom. And one last little secret on how to decrease blood pressure, and that is laughter. Ha ha ha! So if you are laughing, you are decreasing your blood pressure, decreasing your stress levels. Actually, it's been said that you can actually lose weight when you're laughing. So I just love laughter because it reminds us that no matter what is happening around us, right, in our immediate family, in our work, or in the world, if we remember to laugh, we immediately bring ourselves back into the moment, into this moment, and that there is joy in just being present and grateful. And so I'm grateful for you, Dr. Devin Miles, and we will see everyone hopefully next Wednesday. Please register, everybody. We're going to answer your questions. We're going to have some fun, spreading some love and peace. So thank you, everyone, for joining us tonight. We'll see you next Wednesday, April 21st.